Can I go? Okay. Hi, okay, so we have nasogastric tube placement. So before I begin this procedure, I'm going to check with the MAR and the orders with the PCP to make sure that we're doing the correct procedure, which I did, okay? So now I'm going to go into the patient's room. Knock, knock. Hello, Mr. Jones. My name's Kalei. I'm going to be your nurse today. What we're going to be doing today is a nasogastric tube placement. So do you think you can tell me your name and your date of birth?
Mike Jones, 7/12/52.
All right. And do you have any allergies?
No.
No allergies. All right. So checked that. So now what I'm going to do is provide privacy and wash my hands. And now I'm going to raise the head of the bed to a good working height. And I'm also going to raise the head of the bed to greater than a 45-degree angle for this procedure. Okay. So now I'm going to get all my supplies ready, which I'm going to do. Have this and open this up. Okay. And are you in any pain right now?
No.
Okay, if you are in pain, there is per policy for the hospital to do some lubricant for your nose. And also I'm going to check your nasal passageways to see which one is the best one. We're looking for any obstructions. And it looks like your left nasal passageway looks great. Have you had any nosebleeds or a history of nosebleeds or any obstructions at all?
No.
Nope, okay. So now what we're going to do is I'm going to measure the placement for the NG tube. So what I'm going to do is measure from your nose to your ear to your xiphoid process. This just allows us to see how much of this tubing needs to go to get to your stomach. So from your nose to your ear and then to your xiphoid process. Okay. And so what I'm going to do is I'm going to mark this with a pen, and this is just so we know where to place it at. So here. Okay. So before I begin the procedure, I'm just going to explain what I'm going to do. So I'm going to insert the gastric tube. When I insert it, it might feel some discomfort. And so when I insert, I'm going to have you tip your head back. And once it hits the pharynx, you're going to experience like some gagging and maybe tearing from the eyes. And then I'm going to ask you to tip your chin down. And then when I do that, I'm going to have you take sips of water. And as you take sips of water, I'm going to insert the tube. If you feel any discomfort, please raise your hand and let me know. And then I will stop the procedure. Yes, so I'm going to go ahead and put this bath towel on you so you don't get anything on your gown. And I'm also going to, here's a tissue for any tearing for you, okay? And here is some water with a straw. And I'm just going to have you hold this right here. Just want to tell you to take sips. And then here is also an assist bin just in case you need to vomit. All right, so now I'm going to go ahead and put on my gloves. Do you have any questions about the procedure?
Is it gonna hurt?
You could experience some discomfort, but I will try to make it as painful as possible. Okay, so here's some lubricant, and I'm going to go ahead and put that there. Okay, so now what I'm going to do is I'm going to put the tube in the lubricant. Okay, so I'm going to go ahead and insert the tube. As I said before, if you experience any discomfort or coughing and vomiting, let me know, and then I'll stop the procedure. So go ahead and take a deep breath for me, and we're going to go ahead and insert it. Okay. And it looks like we've reached the pharynx, so go ahead and take sips of water. And as you take a sip of water, I'm going to keep inserting the tube until it gets down into the stomach. Okay. And I wouldn't be doing anything forcefully at all with this procedure. So now what I'm going to do is take a piece of tape and secure secure it. So while we check placement of the NG tube. Put a little piece of tape here. Okay, so to check placement, we're going to check with an X-ray, but also what you can do is aspirate about 30 mils of air and have another nurse help you listen to bowel sounds as you aspirate the hair, and you should hear some gurgling sounds in the stomach. I'm going to go ahead and do that. Also, we're going to aspirate some stomach secretions. Okay. And for the rest of the tube, I'm going to put this here. I'm going to keep it above the stomach while I secure it. And you can just secure it with a safety pin or a piece of tape. Okay. And now with the stomach secretions, I'm going to test the pH of it to see what the pH is and to make sure that we did indeed were in the stomach region. Okay, so now that I've checked placement with an X-ray, now I'm going to fully secure the tube with a better piece of tape than just a little piece. Let's go ahead and cut this. Okay, I'm going to take this off. I'm just going to go ahead and wrap it around the nose and the tube just so it doesn't fall out at all. Just like that. Okay. Secured that. All right. If you experience any discomfort, shortness of breath, coughing, irritation in your nose, please let us know. Any vomiting, I'm going to be coming back about 30 minutes to check on how you're doing with your nasogastric tube. Do you have any questions for me?
No.
Nope? Okay. So now what I'm going to do is clean up all my supplies. I'm going to take off my gloves, and I'm going to lower the head of the bed and lower it to a good, all the way down to the floor. And the bed shouldn't be any lower than 30 degrees. And also, please, as I said before, please let us know if you have any discomfort at all. Your collates are right here on the bed, and I'm going to wash my hands, provide for privacy, and then I'm going to document. I'm going to document what I placed, well, the NG tube I placed, but what time I placed it, the specific nodule, which was the left, and then I'm also going to document the gastric secretions and the level of the pH, and if there was any difficulties with the NG tube as well. And I gave the collate that. All right. Thank you, Mr. Jones.